Welcome to Transplant Talk Live. So this is kind of like the live version of our monthly newsletter, which is called Transplant Talk. And it just gives us an opportunity to delve a little bit more deeply into some of the topics that we cover in that newsletter. My name is Jen. I am the Marketing and Communications Manager for Arrow, and I'm coming to you today from the lands of the Darramurrugal people up in the north side of Sydney around the Turramurra and Timber area, and it's a beautiful place to be, and I'm very grateful to the Darramurrugal people that I've been able to live here for such a long time. The webinar today will have an interview between Yvonne and Nikiya, and there will be an opportunity at the end for you to ask some questions. If you have questions, please put them into the Q&A tab. There is chat available as well for you to interact with each other, but it's the Q&A tab that I'll be going to find questions at the end. So if you have something that you'd like to ask, please type it in there. I also need to remind you that although our guests are experts in their fields, we can only speak generally today, so we can't give you any specific advice to your situation. If you have any questions about your particular situation, we encourage you to get in touch with your transplant team. I would also like to thank, before we get started, Tour de Cure, who have helped make this webinar possible. Now, sadly, I've got some very sad news. Unfortunately, due to circumstances beyond anyone's control, Nikhil Altar, the New South Wales Young Australian of the Year, won't be able to join us tonight. He's quite sad that he won't be able to be here, and we're sad too that he won't make it. We are talking to him about rescheduling for later webinar, so keep an eye on emails and our socials, because we'll be telling you about that for sure when it's available. So, but we do have tonight Yvonne, who is joining us today. She's coming to us from Naarm, which is Melbourne, and the lands of the Kulin Nation. She will be hosting our webinar today. Yvonne is a clinical nurse practitioner at the Peter MacCallum Cancer Centre and also the Royal Melbourne Hospital. As well as that, she's the co-host of the Straight and Narrow podcast, so she's absolutely no stranger to interviewing people and giving presentations. So we're looking forward to that tonight. And as well as that, Yvonne is a director of the Arrow board. Over to you, Yvonne.
Thanks, Jen. Thanks, Rochelle. Thanks, Arrow. And thank you to Nikiya, who has stepped in at short notice, and we're so excited to be having this conversation with you tonight. And thank you to the audience for participating. So I just would like to tell you a little bit about Nikiya, because it's important that you get to know her before she shares her wonderful story, which is full of many mini stories, which will really captivate you, and I'm sure you'll have lots of things that you would like to ask Nikiya at the end. So Nikiya Love was diagnosed with acute lymphoblastic leukemia at the age of 30 when she was 16 and a half weeks pregnant. Treatment was started urgently, and sadly Nikiya and her partner David lost their daughter Lexi. Nikiya had 5 rounds of chemotherapy, 2 rounds of blinatumomab, followed by an allogeneic bone marrow transplant. Nikiya loves Pilates, the ocean, interior design, and her dog Louie. She's a passionate advocate of women's health and bone marrow donation, just to name a few, and she's going to tell you about a lot more. Nikiya and David own a business in the renewable energy sector. Now, at 12 months post-transplant, Nikiya is navigating her way through life and all its fullness, and she's going to share her story with us this evening from Darawal country in Wollongong. Thank you for joining us, Nikiya.
Thank you for having me. It's a pleasure to be here. I would like to just thank everybody for their time this evening as well. I think I was just mentioning off air, but time is such a precious commodity. So it's important to acknowledge that and thank everyone for their time this evening.
Yeah, and look, I think we should explore that a little bit more as we move through our conversation, that whole concept of time and, you know, what that, you know, how the definition and interpretation and use of that time changes after a significant experience like an allogeneic transplant. So I would like to begin by inviting you to tell us about Nikiya Love outside of a cancer diagnosis and an allogeneic transplant. So tell us a bit about you.
Okay, happy-go-lucky. We'll talk to anyone. Loves a good coffee. And also just really, really loves being around family and friends. Family and friends are everything to me. I have always been an extrovert. I've also always had a very large group of women and men who I would say I cheerlead, like I'm a big cheerleader. Enjoy not taking life too seriously whilst also ensuring that I am showing up for people in their life, I think is the biggest key for me. Yeah, even before everything, it was always just sometimes stretching myself a bit too thin, but wanting to be there and present for every party or every birthday or every birth or every event that I could. Yeah, in show of support for the people I care about the most.
That's great. And, you know, obviously that was became really important when, you know, in return, you needed support and people around you when you were diagnosed with ALL, acute lymphoblastic leukemia, and needed to come into hospital for treatment. So tell us a little bit about, you know, finding out about your ALL, your diagnosis, and then, you know, step us briefly through your treatment.
Sure. So as you mentioned at the start, I was 16 and a half weeks pregnant on my diagnosis. Sadly, we did lose our daughter, Lexi. I went to the emergency department because of her. I was feeling short of breath, fatigued, and a little bit dizzy for about 2 weeks leading up to that. But everybody was just assuring me that I was doing too much. I was pregnant. I wasn't listening to my body. And I was experiencing everything that anyone would ever put down to pregnancy symptoms. I guess you could call it a motherly intuition, but something didn't seem right. And I kept on saying to my family and friends, something's not right. They say you should be thriving in your second trimester, and I've breezed through my first and I'm in my second and I feel the worst I've ever felt. Something's not right. I was sleeping for 3 hours in the afternoon, and then I'd go to bed for that night and sleep a solid 8. And I just could not get enough sleep. And it wasn't until I was washing the dishes one evening that I became short of breath and felt really dizzy. And I said to my husband, I need to go sit down. And he said, he's a very pragmatic individual. So for him to say, I think you should go to the doctor, rings alarm bells. And he said, I think you need to go get checked. And then that same evening, I started to experience some cramping in my stomach. So in fear of my child and my baby, I contacted the maternity department, who informed me to contact my GP, who then was not working that day by chance. However, they did lead me to the emergency based off of my history, my medical history. And I then went into emergency where they performed some blood tests. They told me that my white cell count was slightly elevated, but that was very common in pregnancy, followed by sonographer scans on our child. to inform me that she was appearing very small, but we wouldn't say too much, and that I was going to be reviewed by the head of the maternity department. The head of obstetrics came down to ensure I wasn't miscarrying, which I wasn't. However, they admitted me, and then the following day I received a visit from haematology to inform me that something had shown up on the bloods that they had collected in ED, and that I was being further investigated and hadn't been sent home yet because they were concerned I may have leukemia. Said to my husband, typical specialist, always think worst case scenario. This isn't about me, this is about our baby. And I was visited after a few more tests 3 hours later to be told that in fact it was acute lymphoblastic leukemia, and that I had what would have potentially been 2 weeks maybe, because everything else in my bloods was stable except for those couple of blasts that were showing at that stage under microscope. However, it was acute and it seemed quite aggressive, and that we needed just to begin treatment straight away. So that followed with a bone marrow biopsy on the Friday, on the Sunday, and my first platelet transfusion, because they were dropping within 48 hours, and a lumbar puncture spinal tap to check my central nervous system fluids, and an intrathecal chemotherapy into the spine. So yeah, it was whirlwind time.
And then, I mean, obviously then, as we talked about in the introduction, you had chemotherapy and you had also some targeted therapy, which is now very commonly used for many types of cancers, including hematological malignancies. And then obviously there was a decision to proceed to an allogeneic bone marrow transplant. So tell us a bit about that. Who was your donor?
Mm-hmm. Okay, so yeah, it's not the case for everybody, so I think that should be addressed, that not every ALL diagnosis will lead to a stem cell transplant. However, in that first week of my treatment and the bone marrow biopsy results coming back, it was flagged that I had what is known as a Philadelphia chromosome abnormality, which put me into what was referred to as a higher risk category within my ALL diagnosis, and that if I were to achieve a long-term cure, the end goal would have to be a bone marrow transplant. There was not another option there. Some people do go through what's known as maintenance, or chemotherapy and then maintenance, and bone marrow transplant might only occur if they relapse, but in my instance, it was always going to be a bone marrow transplant. So I knew that that's what I was working towards from the beginning. That trajectory did, however, change because of what happened throughout my own treatment of chemotherapy. As you said, blinatumomab is not a medication that's given again to everybody, but I did need that before transplant. So I had 5 cycles of chemotherapy in which I was a inpatient for. It was 21 days at a time per cycle. I had a targeted inhibitor medication known as dasatinib, which is specifically for the Philadelphia chromosome itself throughout that whole time as well. I was 40 when they did my marrow, so it was quite aggressive and it was happening quite quickly. And I had also shown on the CNS vial that there was some potential leukemia in there, but it was it was like one singular blast that they could see under microscope. So they chose to put me as a high risk anyway, which meant I had more intrathecal chemotherapy than would normally occur in a per cycle of chemo. I then had, gosh, 5 cycles of chemotherapy. I went into remission. On my first cycle of chemo. So my body responded quite well. I was very fortunate that I went into remission after that one cycle. Now, Yvonne will have a better understanding of this potentially, but from what I learnt later down the track, I was in remission, but that is if you show 5% or less on your bone marrow biopsy. And pre-transplant, my team wanted me to be what's known as MRD negative, minimum residual disease, and I was still showing up on minimum residual disease, which is what led to my blinatumomab.
Yeah. And so at that time, they would have been looking for a donor for you as well. And so your donor was identified, and were they a sibling donor or an unrelated donor?
Yeah, unrelated. My donor, he, German man, unidentified to me, now share his DNA, can get away with a murder. No, but we went straight away. I was informed first cycle of chemotherapy, they'd be testing my sister to see if she was a match. I have one biological sister. She came back as a partial match on the HLA matching. They, at the same time, went onto the Australian registry, in which I had 0 matches, and then went to the global donor registry, in which I was extremely fortunate to have not 1 but 3 German donors, which is,
I must say that the German population are very generous. That they provide us with the highest number of donors, international donors. So
I've been told, and again, there was delay in my treatment, so due to the donation from the donor. So originally they had hoped my chemotherapy cycles would have been about 4 cycles. They said we're unlikely we will probably go past 4 because the donor will have the donations and the stem cells ready for you by, they were hoping October at that stage. There was a delay on his end for giving, for whatever reason that may be. And then it was pushed. He gave in his stem cells in November. It was then going to go into treatment for November, but then after the 5 cycles of chemo, which ended in October, November, was when they also did more bone marrow biopsies to find out I was still MRD positive. So his stem cells were actually cryo-frozen, and they stayed stored until I received them after doing the blinatumomab 2 cycles, which is immunotherapy, which looks very different to chemotherapy as well, mind you. I was at home and I was walking my dog and I was hot air ballooning and I felt riding a bike. I felt fantastic. And then we went in February of 2023.
Yeah. So what I'd really like to explore now is, obviously, I'm sure there will be people that are really interested in that period of time during your transplant admission. And rather than going through the technicalities, because everybody's experience is quite different when they have their transplant, do you have any specific tips pre, during, and immediately post-transplant? Things that really helped you, examples such as, getting a group of people together to help support you and help support your partner. Did you do any preparation around exercise and diet, meditation? How did you look at mental health in preparation for going in for transplant? Because, that period of waiting, it can be anxiety provoking, and then you get into hospital and, there's so much you've got to do as well. So just if you can talk us through some of that, that would be great.
Sure. I was provided the bone marrow transplant booklet, which I later found out Arrow actually has an involvement with. I read that page for page. Yes, but I didn't know that at the time, but I read that from front to back. There was a section in there and it said, I think it was around graft versus host. And I remember it saying in the corner, you know, don't feel the need to read this now, skip to page 34 or whatever it may have been, or 86 or whatever. And I went, okay, we'll deal with that later. So I was conscious of being informed and knowing that knowledge is power. However, ignorance is also bliss. So for me, it was being aware as to what could go wrong and what may go wrong, whilst also protecting myself and protecting those around me, which was ensuring that I knew that whatever I was going through was going to be my body and therefore nobody else's experience. No two people are the same. And I learned that through my chemotherapy. You know, I think for that reason, it was really important for me to remember, just because someone else had gone through something didn't mean that was going to be the case for me. And I think that was what that mantra.
Yeah.
Correct. Be aware but not alarmed. That's great. Yeah, exactly.
And so did you encourage your family and friends to read the information that you did as well? Yeah.
Yeah, I did. I sent them the PDF. I had a PDF form of that book, as well as, I think, my transplant team, the social worker, had actually sent me that PDF as well as the booklet that I was given. So I had the thick book, but everybody else had a PDF, and I forwarded it through, and I just said, like, look, if whomever wants to read this, you know, it might be beneficial and it may be helpful for you.
Yeah, I think. Did you have a roster of people who help support you during your transplant? So, you know, did you kind of have a contact person that everybody else could contact to take the pressure off yourself and Dave? You know, did you have people who were helping with, say, preparing meals for Dave? Or, you know, what are the sorts of things you took into hospital with you to make things a little more comfortable?
Yeah, so one of the biggest, again, key advice from my specialist, which I took on board, which was there's often you lose weight through transplant. So make sure you come into transplant with a bit of weight to lose. So over Christmas, I indulged in cream and butter and pavlova and sugar and all the things that I knew was going to help me put on some extra weight for that time. They said now's not the time to go on any crash course dieting or anything. So I eat away, which I did and enjoyed very much. I also did have some support from my family and friends. So my sister, fortunately, she's actually a nurse, and I was very lucky to have her by my side. And what she did was set up a community group chat page, like in, I think, what was Facebook Messenger. I wasn't involved in that, and I'm grateful that I wasn't involved with that. I actually asked not to be involved in that. It meant that I just had one point of contact between my mum and my sister, and then she was able to copy and paste that into a group and receive all of the feedback and love and support, or whatever it may have been that people were offering, but not have to inundate me, like, because what I was focusing on at that time, and Dave as well, my husband, what we were focusing on at that time was my survival and getting through it in whatever way we could. As for meals, again, it was that I had a gastric tube, so I wasn't eating. I also had a very restricted diet in my post 100 days with the immunocompromised medications. So I lived off hash browns and chicken nuggets once I finally could eat. I also had taste buds that had gone for quite a time as well. So taste was, and ulcers and all sorts of things that occurred that I just didn't. Yeah, so food wasn't my favorite thing at the time, but
yeah. And look, I will point out that different transplant centers have different protocols around what you can and can't eat during transplant, so there will be variability. And you should be guided by your transplant center around those sorts of things. What did you do during your transplant admission to keep yourself occupied?
well, at the beginning, I was on my bike, which was quite cool. They had a gym room. I sat there, and the first few days of conditioning, I actually was on the bike and the treadmill and just keeping myself moving. Fitness is a big part of what I enjoy doing, and I knew that I was potentially going to be sedentary for quite some time. So I thought, well, now's the time to just keep my body going while it can. And I did end up becoming quite sedentary. So it was good that I had that little. Other than that, look, I'd be lying if I said I didn't sleep 80 to 90% of the time. I treated, my mantra was sleeping is healing. While ever I was asleep, my body was able to do what it needed to do in order to survive. And I was in the best place that I could have been for that transplant, around a very wonderful team. And I felt very safe, and I felt very cared for, and I just had to, what I considered to be giving up all control, or at least just being tall and saying, I don't have control over this, and I'm going to let the people that know what they're doing look after me.
Did you do anything specific for your mental health during your transplant admission?
Yeah, it was actually really funny. Spotify did a Wrapped series last year or something, like your Spotify Wrapped, and it was all meditation.
Right.
All meditation.
Amazing.
I can send you the link, actually. A macaron unicorn on Spotify. It's just meditative music, and I just had it on all day, every day in my ears. I think it must have been what got me to sleep, what just put me into some kind of trance, and away I went for 5 weeks.
So what was that, macaron unicorn?
I'm sure it's macaron unicorn or
okay,
something.
You go everybody on Spotify.
On Spotify, but that was my rap. Yeah, but no, meditation, and also just like 5-minute missions every morning. I would remind myself, there was like one, I can send some links if anyone is interested, but it was around, my body's doing what it needs to do, or my cells are working within my body, like just those little mantras of positivity that also, again, when you have no control, made me feel as though I had some kind of insight. Yeah,
that's really beautiful. And so you started with those mantras. Would you say them out loud, or would you write them down? How did you practice those?
No, just listening and repeating in my head. Yeah. My husband had one that he would often say to me as well every day before he left the hospital. He would also say one to me, and I would repeat it back to him, which was quite lovely. So there was that one as well. But again, that was more just in line of that I was strong, that I was brave, that I could get through this. And there were days where I was obviously very unwell, and that were very, very challenging. But even if I didn't necessarily feel as though I could repeat it back to him, he was still saying it to me. So.
Yeah, that's great. Would you recommend starting to think, for the audience and anyone who's preparing to be admitted for an allogeneic transplant or an autologous transplant, would you recommend people actually start to practice those things before they're admitted to hospital, so they feel comfortable in that practice before they go in?
Yeah, and again, I think this is something that is individual to the person. I had sought mental health support throughout my entirety of my diagnosis and before. So I was very comfortable with reflection work, with self-awareness, internal, looking internally, and knowing what filled my cup, and knowing what was something that I could do for self-care. It's actually one of the things that, again, from my experience, we weren't allowed flowers in our ward, and I also wasn't allowed candles. So to me, having a bunch of fresh flowers was beautiful, or having a candle lit was beautiful, but I couldn't do that. So it was, again, finding other ways. So I was gifted some Lego flowers, and I was gifted some, things that I could do whilst in hospital that was still bright and colourful and could sit there in my room and look and, feel bright and happy, but in just all of these alternative ways. Which is interesting.
Which is fantastic.
Yeah,
that's great. And so, although everybody's experience is quite different, and what supports people need, and what makes people feel more fulfilled or more calm or happy will differ from person to person. Would you recommend that if opportunities are provided to people around mental health support, that they consider them?
Yes, without a doubt, without a question in my mind. Absolutely. And again, I think that's really scary for a lot of people as well, particularly if you haven't. So essential, and it's so helpful. And my way of dealing with doing therapy at the same time, because you are going through a lot, right? You're going through a lot physically as well as emotionally. But what I reminded myself of was that it was important for me to look after my mental health in that time, because my body was doing so much. So why fight with my mental health at the same time that I'm fighting for my physical being and my body? And that's how I justified it, if you will, to say, I'm not going to make this harder on myself. I'm going to make this as easy as I possibly can. And that was with therapy.
Yeah, great. Thanks for sharing that. So I want to move ahead a little bit further along to
Sure.
go on after transplant. And just obviously it's a really it can be a really grueling time, and for some people even more stressful, because you don't have the comfort and the ready protection of your transplant team, the nurses, the doctors, the wonderful allied health and social workers. So, coming in and out of hospital for those checkups, that's quite grueling. But then also people start to think about, okay, well, there is a life after transplant, which is wonderful, and thinking about getting back into the things that you love, but in a different way. Can you share with us your experience around managing the early period post-transplant, but also starting to prepare for your re-entry, your debut back into society?
Days was very challenging, because I was a bit of a hypochondriac, if you will. But I think after what I'd been through, every little symptom or any little bit of anything that resembled graft versus host, I was straight on the phone to my medical team, or I was straight to ensure I had those follow-up appointments, to observe something. I think I was, again, fortunate in that my team were like, any concerns, just call us. It doesn't matter if, I think particularly within that 100 days, don't be afraid. You can't hassle anybody too much in that stage, because, I did actually re-enter hospital after that, only for a 4-day stint, but I did need another transfusion of blood product. So there was a few things there. I actually ended up with a virus, which was, again, something that I was really terrified of, but ended up back in hospital to have some fluid there, and just to ensure that that was treated and cared for. I think that was probably the hardest time for my husband. I was still sleeping a lot, but I think he felt a great deal of responsibility at that time, to be looking after me. I also did need, I couldn't drive, so he was taking me to appointments, and I also wasn't extremely mobile. So there was a lot that he had to do during that time. So we arranged for my mum to come up once a week and she would stay overnight, and he would actually come home away from where I was staying and come back to our house, and that was his time, 24 hours or 48 hours to reset himself and care for himself, because that was so important for him and his mental health as well. And my mum would care for me over that period. So again, not being afraid to reach out to people and really lean into that support and seek the help and care from others, because it's a lot to carry for one person.
Yeah, absolutely. So that's a really good point. And I think it's one that we should really emphasize, is about, building your tribe, building your village of people who can not only support the transplant recipient, but also the carer. And you bring up a really good point, Nikiya. I mean, obviously you're from a regional area, albeit you had to move for your transplant, and
we did.
You had to uproot yourself from your community and your home, all of those familiar surroundings. So even when you were discharged from hospital, you weren't at home.
Correct. No.
Yes. And that's difficult for you, as you mentioned, but also difficult for the carers. And so that opportunity to visit home is a really important one.
Yeah, definitely. I think I personally felt the best. I was told it's a marathon, it's not a sprint. And I could see the improvement every month. And then when I did finally get home after that 100-day period, by the 6-month mark, you're receiving your reimmunizations, you're receiving them, at 6 months, at 12, I think it was 6, 8, and 12 from memory. And just the physical changes that I saw whilst being slow myself, for those who weren't seeing me or had seen me during the transplant, who were then seeing me 5 months later, were just shocked at how far and how quickly I had progressed into what appeared even now to being almost back to normal, if you will. Not that I'm not there, but I think for others it may appear that way.
I want to touch on that, because in our preparation for today's webinar, we talked about mental exhaustion and the kind of the period after transplant, so what we call long-term follow-up or survivorship, and an area that's dear to my heart, and people talk about what you spoke with me about, that you look, people say, oh, you look great. And so there's this expectation that you feel great, both physically and mentally and emotionally and spiritually. And that can be really challenging and exhausting for people. In our last, few minutes or so, can you talk a little bit about that period, that transition period that you're going through now? And perhaps even if you wouldn't mind, and I'll remind you if you forget, is around getting back into work as well.
Yeah, sure. Chemo brain is the real thing, so I absolutely do forget, and I do need constant reminding. The transition has it definitely caught me by surprise. I think I also had expectations on myself that I'd get to the 1 year mark and I'd suddenly be feeling good enough to be back at work, or that I would hit the 1 year mark and suddenly not feel any more anxiety, or I don't know what I thought would happen, to be honest. So it's been a learning curve for me to give myself some grace. It's really, I think, we have to remember to give ourselves some grace. We're not both physical and mental states. I see a point of view very differently these days. I was only mentioning to yourself and Jen before we got onto the podcast, I probably struggle to show as much empathy as I used to before, because I've been exposed to so much, and therefore I have a different mindset around things in life. That has been hard because I've had to have people almost see me and assume that I do look so great and that I do look normal. However, remind people constantly that I'm still fatigued, that I still, like, this is chronic. And I think it's important that we address that this is chronic, like a bone marrow, like I was saying, it's a marathon, not a sprint. So therefore, the recovery is going to be slow. And I need to be more kind with myself, but also with my boundary setting, in that I can't necessarily attend everything that I'd hoped to attend like I used to before I had my treatment. That I have to learn to say no to protect my well-being and my own physical health in that state, but also to just remember that I've come so far, but yet there's still so much more to go.
Absolutely. So would you say being honest and communicating well
yeah,
with people around you would be
definitely. And I think we also just have to, there's something about it that I don't really know how to articulate. And this is where, again, therapy is so beneficial. But there's something, being vulnerable and sharing that, but also being aware that everybody else is living a life. And for a very long time, like my treatment's gone for over 2 years now, they've heard me talk. They've heard me go on about how tired I am. They've seen me at my absolute worst. They kind of just want to move on. And that's okay, and that's okay. But it's important for me to then remind people and come forward and state to people, well, what, I actually am still sleeping until 10 o'clock in the morning most days. Or, what, I actually am doing a bit of work, but it is only on a casual basis. And I don't see myself returning back to full-time work anytime soon. And you know what? The other thing is I've only just had 1 year, which is a phenomenal milestone, which I absolutely celebrate and embrace. But that was the day that my stem cells were transplanted.
Mhm.
We're not talking about the days that followed the next 4 weeks of my hospital admission and the 100 days after that. So again, reminding myself that I'm a newborn baby is one of the things I would tell myself, a little mantra, and what my team would often say. And I can't walk before I crawl. So, I couldn't eat the food before I could eat the puree. So it's all about baby steps.
Yeah, about pacing yourself. So
Yeah.
Nikiya, that's a really it's a really great point and great wisdom and advice from personal experience to end our conversation on. I mean, we could talk all night. I mean, you and I both love a conversation. We've established that, haven't we? We're both chatted.
Yes,
going on and on and on. But we have some fantastic questions in the chat and in the Q&A, which, and I'm going to invite Jen back in, who is our wonderful host, who's going to lead the Q&A. So, I mean, this is not goodbye yet, but I'd just like to thank you for spending the last 40 minutes having this conversation. And I invite people to post their questions. And over to you, Jen.
Thank you. Thank you very much, Nikiya, for being so generous with your story today, and I guess being a little vulnerable and sharing with us some of the emotional and the spiritual things that happened to you that people wouldn't necessarily consider as part of what we tend to see as a straight medical procedure. We seem to be quite clinical around that, but it's a real person who is going through this with all of the real person things that we all experience. It's just you've had it heightened, I think,
Yes.
by what you've been through. We've had a few questions come in. I think you may have touched on a lot of them. There's a
Okay.
couple in particular from people who have had bone marrow transplants around about 6 months ago, wanting to know a little bit more about the trajectory of your energy levels coming up again. They're kind of at that, well, I'm 6 months past transplant and I'm looking to the future, wondering when or how I can manage getting back into some work or, you know, that kind of thing. Anything to say about that?
I documented everything, and this isn't something that everybody chooses to do, but I did. I documented myself taking my first walk out of the ward. I documented myself on oxygen. I documented my graft versus host rashes on my legs. I documented the first time I saw any kind of hair growing on my head. And I look back at that all the time. And I think it comes back to those baby steps. As humans are always seeking the what's next, you know, what comes next, when we want to know now, we know we want to be there today. Just sit with the complacency for a bit. Just sit with that. Just sit with the fact that you're here. Sit with the fact that you are alive. And that 6 months ago, you were laying in a hospital bed, probably wondering if you were ever going to see the light of day again, because that's what I was doing. So I look back at those photos, as hard as they are to look back at. I look back and I think, gosh, and you know, work will come. Work will always be there. Work's always going to exist. So is most things in life going to be there for you waiting. I've put my university degree on hold for 2 years now. University's not going anywhere. Work's not going anywhere. You know, you might let some people down in that process. You might disappoint some people. You may find that you actually were looking for a new job anyway. And this is, take this opportunity to go and land into something else that you're more passionate about.
Yeah.
But just be kind to yourself. I know that sounds really simple. I can tell you it's not easy to do. But yeah, give yourself that grace and just be kind to yourself and think and remember what you've just been through. You've reset your body. You've actually got a brand new DNA. You've got, for me, I've got a brand new blood type. And I remind myself of that. Like, I have reset myself. I am a baby all over again.
Yeah, I think that's a really great approach. We've had a question. This one's probably for you, Yvonne. So someone here asking, when you do blood tests, is it a standard thing to check for blood cancer? Or is there something that prompts people to go and look more closely at what's actually going on, the nitty-gritty details?
Yeah, so obviously with leukemia, it can affect a number of different parameters within the blood test, but specifically there will be an abnormality with the white blood cell count. So it's not, although there are, and Nikiya mentioned there are specific molecular markers that we can test for once we know someone has leukemia, and there are a number of different types of leukemia in addition to ALL. So there are particular molecular markers that can help us monitor disease response to treatment, but those specific molecular markers are not done as part of routine blood testing when you go to your GP and have your cholesterol checked, or have your diabetes screen or whatever. But a full blood examination, which looks at hemoglobin, white cells, platelets, is a blood test that is ordered on occasion in the community by GPs when people go in to see their GP with specific symptoms. And that may be bruising or fatigue. It may be shortness of breath. So then that may spur a community doctor or nurse practitioner to order an FBE, which may lead to other more specific tests.
Thank you.
Thank you for the question.
Yeah, it was a good one.
Mm.
Yeah. And there have been a couple of other questions around sort of anxiety and managing that, in particular, if something, you feel that you're making progress and you're recovering well, and then something happens that you get a little bit concerned about. And there's another patient that I've seen interacting, I think probably on your account, Nikiya, who calls it scanxiety. With all the tests that you have to keep having, and that that just in the back of your mind, that niggle all the time of what if it's not good news? How do you manage that kind of anxiety now that you're kind of past a year, past bone marrow transplant, and everybody thinks you're looking normal and great and well and healthy?
Yeah, I still have my peripheral blood taken once a month, and I have just extended that to 3 months. So there was a huge transition there in moving from 1 month to 3 months, because 1 month I felt as though something would be flagged quite quickly. If something were to go wrong, it would be identified quite quickly. And now 3 months later, it feels like, 3 months feels like such a long time. But I, again, just remind myself how terrified I was when I went from 2 days having blood tests twice a week to then once a week, from once a week to then 1 month, and so on and so on. So I personally don't have any. If anyone has any advice, please tell me, because I'm currently stuck in that limbo land of how do I deal with this. No, what I've been doing is do things that make yourself feel good. Keep yourself distracted. Find the things that you enjoy doing. Take up a new hobby. I actually just started cross stitching. It was so therapeutic. So if anyone's interested in that, give it a go, whatever it might be. But just lean into what makes you feel good. I think during that time, particularly, sometimes my tests take 3 weeks before I get the results back, because they are sent to specialist labs for testing, and 3 weeks is a long time to wait. It's really challenging. But I, again, just remind myself that there's nothing that I can do that's going to change the situation or the outcome of those blood tests, except for look after myself in the moment. I think it's simple as that, really, which is not simple at all, is it? But yeah, I think
and
just
Jen,
reminding us.
Add to that as well. And look, I think that, we have to take some responsibility for that as healthcare providers, because, what we impose on people during their transplant are daily blood tests. And then we discharge people, and then we do their blood tests 3 times a week. And then, we, with very good evidence, increase the length of time between blood tests. But, I think it's really important that we recognise the psychological impact that is, going from that really intense period to a period that, we're helping people to, re-enter some degree of normality, whatever that is, and that's different for everybody. But, we try and, encourage people to become more comfortable with less intensive follow-up, but it does come with a massive impact. So I would encourage audience members to talk to your transplant team if you're feeling anxious. Be reassured, particularly by the fact that it's not just all in a blood test. There are so many other clinical things that we look at when we're monitoring people after transplant, monitoring them for graft versus host disease, monitoring them for other complications or for relapse. So it's not, that's one part of the really big picture. And a really important part of that picture is people's own self-monitoring as well. So giving tools to be able to then report back to us if they're concerned about anything.
We've got
I think
time.
again,
Oh, sorry, go ahead,
oh,
Nikki.
just on extension to that too, I think Yvonne makes a really good point, but I think with reaching out to your transplant team, but also your GP, lose a little bit of contact with your transplant team. So I often will just reach out to my own GP as well. And whilst they're not necessarily as equipped across the transplant protocol itself, it just, they can run a blood test if needed. They can reach out to your specialist if required. Yeah.
Yeah, that is such a good point, Nikiya. I'm so pleased you brought that up. And having a good GP and establishing a relationship before you come in for transplant is super, super important because, most GPs may only see 1 or 2 transplant recipients in their entire career.
Mm-hmm.
And the sooner you start to, I suppose, enable them to become informed and involved in the process and comfortable looking after someone who's had a transplant, the better it is for the transplant recipient, particularly people who don't live in metropolitan areas. So that and connecting your GP with your transplant team is really, really important as well, because we can provide your GP with a lot of support to make them feel more confident looking after transplant recipients. So I thank you for bringing that up, because that is important.
Yeah.
So we've got time for one last very quick question. Christopher has thanked you, Nikiya, for sharing your experience. He's really grateful for that. And says, in hindsight, is there anything that would have helped you during your treatment and your time in hospital, especially if it's something that Arrow could help other bone marrow transplant patients with?
The podcast. Listen to Straight and Marrow if you haven't. Oh my goodness, that if I had have known of that resource before transplant and during transplant, I would have shared it with every single person under the sun. Just again, sometimes, and I did actually, interestingly, once I did find of the podcast, The Straight and Marrow, I shared a lot of episodes with family and friends because I wasn't able to. I was feeling a certain way, but I wasn't able to articulate confident in a lot of the thoughts that I was having to be valid, which is, it was something I had to work with internally, but it allowed someone else to talk. It allowed someone else to do the talking as to what I was feeling and validate how I was feeling without it actually being me doing the talking. And that was so powerful, particularly, again, post-transplant, when I was in that 100 days of isolation. I didn't have the energy to reach out to people. I didn't have the energy to reply to text messages, to take a phone call. I was exhausted. I was, like I said, sleeping over 80% of the time. And if I could have just let people know that, hey, this is what a transplant actually is, of what I'm going through in a 40-minute episode while you're out walking the dog, you're actually going to be a huge help to me. That's actually going to really help me in what I'm going through right now.
So for people that don't know the podcast that Nikiya is talking about, it's the Straight and Marrow podcast. Yvonne is a co-host of that, and I'll make sure that that information is sent out to everybody that's here tonight. You can find it on our website as well. So I'm aware that we've just sneaked over the time just by a couple of minutes, so we probably need to wrap up there. Yvonne, Nikiya, thank you so much for giving us your time tonight.
Thank you. Thank you for everyone for participating.
So again, today's webinar was helped with some funding from Tour de Cure. We're very grateful to them. We would love your feedback. There is a short survey that will pop up at the end of this webinar. So if you've got a couple of minutes, it's only like 5 questions, I think, so it won't take you very long. If you've got a minute to fill that in, that would be great. And quickly, just a little bit about Arrow. So we are Arrow, the Bone Marrow Transplant Foundation, and we exist to support bone marrow stem cell transplant patients and those who care for them. And we do that in 3 ways. We have a patient support program. We offer scholarships for nurses and allied health professionals to continue their professional development in the field of bone marrow transplant. And we also support research in bone marrow transplant as well. You can find out more about us on our website. It's arrow.org.au, so www.arrow.org.au. Our next webinar is scheduled for a month, roughly from today on the 7th of May. And this one is with Alex Rivaland and Dr. Ashvind Prabharan. Have I said his name correctly, Yvonne? So Alex is a clinical nurse consultant. She has a particular interest and specialty in graft versus host disease management. And Dr. Ashvind Prabharan is a haematologist, and I believe they're both in Melbourne. Is that right?
Yeah, they are. So Alex is actually the co-creator and presenter on the Straight and Marrow. So that's really exciting. And Alex works also at Peter Mac and the Royal Melbourne, and Ashvind did work with us at the Royal Melbourne and Peter Mac and now works at the Austin. But and you'll actually, if you do dial into the Straight and Marrow, you will see we have interviewed Ashvind, and we do a part A and a part B, and he does a great presentation on the post-transplant period. So I encourage people to have a listen to that. So it's going to be great to have a conversation with them.
Okay, thank you very much, everyone, for coming, giving up your Tuesday night, and we're looking forward to seeing you at the next one. Thanks. Bye-bye.
Thank you.
Thanks, Nikiya. Thanks, Jen.
Bye.
Bye.
Thank you. Thanks, Jen. Thanks, everyone. Bye.